Welcome to the Windsor-Essex County Health Unit's presentation about COVID-19 for staff and volunteers at homeless shelters. Please note that the information in this presentation is current as of April 7th, 2020. Please visit our website at wechu.org for the most up-to-date information. This presentation provides a summary of information about COVID-19 and is not intended to take the place of medical advice, diagnosis, or treatment. For more detailed information about the topics covered in this presentation, please read the following documents: Ministry of Health's COVID-19 Guidance for Homeless Shelters, and the WECHU document COVID-19 Pandemic Action Plan Guidance for Homeless Shelters. Remember that information continues to change, so please check the Ministry of Health and WECHU website regularly for updates. By now, everyone probably already has some knowledge of the novel coronavirus disease COVID-19. COVID-19 is an infectious disease caused by the novel coronavirus SARS-CoV-2. Coronaviruses are a large family of viruses, some of which only infect animals and some only infect humans. Currently, there are 7 strains of coronaviruses that are able to cause illnesses in humans. Some may only cause minor respiratory symptoms, similar to those of a cold, but have also been associated with more serious and life-threatening diseases such as SARS-CoV or MERS-CoV. The strain of coronavirus found in Wuhan, China, at the end of December 2019 is the most recent of 7 known strains. This new strain has never been previously identified in humans, meaning no one has immunity. So the best way to avoid being sick is to avoid being exposed. The virus is spread from person to person through respiratory droplets, such as saliva or mucus, when an infected individual coughs or sneezes. Because this virus is able to survive on surfaces for a long period of time, it can also be spread from touching contaminated surfaces and then touching eyes, nose, or mouth before washing hands. It can take as little as 2 days and as many as 14 days after being exposed for the first symptoms to develop. For most people, symptoms typically develop around day 5 to 6. Common symptoms include fever, tiredness, dry cough, shortness of breath, pneumonia, and in severe cases, death. Very few people will also report diarrhea, nausea, or a runny nose. To date, there is no vaccine and no specific medical treatment to prevent or treat COVID-19, and the elderly and those with underlying health conditions are at increased risk of severe outcomes. To ensure your facility is prepared to manage any clients who become ill with COVID-19, it's important to develop plans that include how to recruit extra volunteers and staff if needed, how to ensure critical job functions have coverage, how to arrange healthcare for clients, how to transport clients in non-emergency situations, and how to access PPE and supplies for staff and clients. It's also important to provide training for staff and volunteers that includes how to properly clean and disinfect, proper use of PPE and knowing when to use it, how to keep a log of clients that include names, times of entry and exit, and how to implement screening procedures. Staff and volunteers. Shelters should avoid using staff and volunteers over the age of 70 and individuals that may be at high risk for COVID-19. Staff and volunteers should self-monitor their symptoms daily, stay home if sick, and contact their healthcare provider or the health unit for advice. Try to use online technology for training and meetings to avoid in-person contact. All staff and volunteers should engage in regular and frequent hand hygiene, good respiratory etiquette, and cleaning and disinfecting of the environment. They should also maintain a 2-meter physical distance from clients and other staff members, and if close contact is required with individuals who are symptomatic, provide staff and clients with appropriate PPE. Screening. All centers must actively screen staff, volunteers, and anyone entering the facility. Screening questions are provided in Appendix A of the document COVID-19 Pandemic Action Plan Guidance for Homeless Shelters. A sign should be posted at the entrance that indicates active screening is taking place, and staff should also be screened upon entry to the building for their shift. Other important points to note are staff and volunteers who have symptoms should complete the ministry's online self-assessment tool and, if required, contact their healthcare provider, and anyone under self-isolation or feeling ill must not come to work. Those entering the facility should be restricted to using one entrance and should be actively screened upon entry. Each person should be asked to sanitize their hands using soap and water or an alcohol-based hand rub. Those conducting screening should ideally be behind a physical barrier, such as a sheet of plexiglass, or maintain a minimum 2-meter distance between themselves and others. A record should be kept of anyone entering the facility that includes their name and time of entry. The following slides will review the screening questions. The following questions must be asked as part of the screening process for anyone entering the facility. Do you have any of the following symptoms? New fever, new or existing cough, and difficulty breathing, worse than usual? Have you traveled outside of Canada within the past 14 days? Have you had close contact with a confirmed or probable COVID-19 case? Have you had close contact with a person with acute respiratory illness who has been outside Canada in the last 14 days? Are you 70 years of age or older? Do you have a chronic condition like diabetes, heart disease, high blood pressure, lung disease, or conditions affecting your immune system such as HIV, AIDS, or leukemia? If shelter guests answer yes to question 5 and 6 only, but no to all others, they should be isolated from others and kept from individuals exhibiting symptoms. These individuals are at higher risk of developing severe symptoms related to COVID-19. If anyone entering the facility answers yes to any of the screening questions or refuses to answer, they have failed the screening and should be isolated and scheduled for medical assessment if showing symptoms. Those experiencing symptoms should be given a procedure mask to wear. Staff should follow these steps to arrange for a medical assessment. Obtain consent to arrange for medical assessment, and once consent is received, contact Street Health to arrange for a virtual clinical assessment with a nurse practitioner. Please note that a computer, tablet, or phone is needed for the client to engage in a virtual assessment. If there are clients in your facility who are waiting for COVID-19 results, they must be isolated or grouped together with others who are also waiting for results. If a client's symptoms become severe, transport them via EMS to hospital. Inform EMS of symptoms. If a client receives a positive result, they should be moved to a designated facility for homeless individuals who are COVID-19 positive. If a client has a positive test result but does not require hospital care, they should be isolated in a separate facility with others who have also tested positive. Clients should remain in their room at all times, including meal times, and should not share a bathroom with others. Their day-to-day health status should be monitored frequently, and if a client's symptoms become severe, transport them via EMS to hospital. Inform EMS of symptoms. Transportation. It is recommended that clients with COVID-19 symptoms are transported alone in a private or designated vehicle, and the driver and passenger should both wear a surgical mask. The passenger should sit in the back of the vehicle opposite the driver to maintain distance. It is recommended to open the vehicle windows to increase ventilation. Clean and disinfect the vehicle after transporting an ill client. Focus on cleaning high-touch surfaces such as door handles and seat belts. For emergencies and severe illness, transportation to hospital should be done by Ambulance Emergency Medical Services, or EMS, by calling 911. Always inform EMS of symptoms. Meal service guidelines. Shelter dining facilities should be organized to ensure that infection control measures are in place and there are no more than 5 people dining at a time. Schedule or stagger meal times to reduce the number of people gathered for meals at one time. If possible, schedule individuals over the age of 70 or those who have chronic conditions to eat at a different time than others. Maintain good hand hygiene at all times and ensure all clients wash their hands before and after eating. Have a sink with soap and water available and/or put sanitizer at the end of the meal line. Require its use to ensure individuals are eating with clean hands. Post signs in visible locations around the mealroom as reminders. Establish physical distancing 2 meters in dining area to keep people apart. Serve food plated, bagged, or boxed if possible to avoid buffet-style service. Do not allow clients to share utensils or food containers such as salt shakers or pitchers of water. Provide individually wrapped plastic utensils instead of open containers of flatware. Ensure that all surfaces of the tables and chairs are cleaned and disinfected after each meal. Infection prevention and control practices. The following infection prevention and control practices are recommended. All staff and volunteers should engage in regular and frequent hand hygiene practices. Post hand washing posters in visible locations around the facility, for example, washrooms, above sinks, and near hand sanitizer dispensers. If wall-mounted hand sanitizers are not possible, consider providing portable hand sanitizers to staff. Ensure hand sanitizers have an alcohol concentration between 70 and 90%. All staff should engage in proper respiratory etiquette, for example, covering their mouth when coughing, sneezing into their sleeve, and properly disposing used tissues. Shelters should post proper cough and sneeze posters in visible locations around the facility. Staff should practice physical distancing in order to limit exposure to respiratory droplets from coughs or sneezes. Consider rearranging furniture and installing barriers to help promote physical distancing. Ensure cleaning and disinfection is performed on a routine and consistent basis. Develop or review protocols and procedures for cleaning and disinfecting. This will help to determine where improvements or additional cleaning may be needed. Follow the proper cleaning and disinfection guidelines as discussed in the following section. Cleaning and disinfecting guidelines. It is not yet known how long the virus causing COVID-19 lives on surfaces. However, evidence suggests it can live on objects and surfaces from a few hours to days. Care should be taken to ensure that clients' personal belongings are stored and handled appropriately. Consider the following. Limit the quantity of belongings that can be brought into the shelter to no more than 2 large bags to avoid overcrowding. Belongings should be stored in clean plastic tubs or bags. Cleaning and disinfecting is very important, and shelters should follow routine cleaning and disinfecting recommendations. When cleaning the shelter, choose products that clean and disinfect all at once. For example, pre-mixed, store-bought disinfectant cleaning solutions and/or wipes when available. Cleaning products remove germs, dirt, and impurities from surfaces by using soap or detergent and water. Cleaning does not necessarily kill germs, but by removing them, it lowers their numbers and the risk of spreading infection. Disinfecting products kill germs on surfaces using chemicals. Read and follow manufacturer's instructions for using cleaning and disinfection products, such as wearing gloves, using in a well-ventilated area, and allowing enough contact time for disinfectant to kill germs based on the product being used. Use damp cleaning methods instead of dry dusting to reduce sending virus droplets into the air. Clean high-touch surfaces twice per day or when visibly dirty. Examples include light switches, doorknobs, handrails, faucets, bathroom areas, counters, touchscreen surfaces, and keypads. Increase cleaning of shared spaces such as kitchens and bathrooms and ensure that extra cleaning supplies are available such as liquid hand soaps, hand sanitizer, paper towels, tissues, trash cans, face masks, gloves, cleaners, and disinfectants. Laundering of clothing, towels, linens, and other items. It is recommended that staff and volunteers wear disposable gloves and gowns when handling dirty laundry and then discard after each use. Wash hands immediately after gloves are removed. If possible, launder items using the warmest appropriate water settings for the items and dry items completely. Dirty laundry from an ill person can be washed with other people's items. Clean and disinfect clothes hampers with a regular household cleaner or line hampers with disposable liners. Sleeping arrangements. Settings such as shelters are considered high-risk settings given the nature of communal living. To reduce risks of COVID-19 transmission, beds should be arranged 2 meters apart. Avoid the sharing of beds and assign beds if possible. Mattresses should be cleaned and disinfected between clients, and clean bedding and towels should be provided to new clients with instructions not to share. Move residents with symptoms into separate rooms or areas with closed doors and provided separate bathrooms if possible. Avoid housing people with chronic conditions or over the age of 70 in the same area as others, and, if possible, open windows for ventilation. Personal protective equipment. Personal protective equipment includes items like gloves, gowns, and masks. Gloves. Wearing gloves does not replace regular and thorough hand washing. Hands should be washed before and after wearing gloves. The same gloves should not be worn to perform multiple tasks, but removed properly and discarded immediately after use. Masks. Wearing a mask can help to prevent the spread of some respiratory illnesses, but it can also become a source of infection if not worn or discarded properly. If you need to wear a mask, you should also clean your hands frequently with soap and water or an alcohol-based hand sanitizer. Surgical masks should be provided to clients experiencing respiratory symptoms, and it must be worn when in close contact with others. Masks should be provided for staff who must have direct contact, less than 2 meters, with an unwell client. Masks and gloves should be provided for the person performing active screening at the entrance if there is no physical barrier between them and those entering. Staff should wear gloves and gowns when cleaning and doing laundry, and gloves if handling clients' personal belongings. Drivers and passengers should wear masks when transporting clients with symptoms. Personal protective equipment is a key element in preventing the transmission of disease. Personal protective equipment must be used properly and safely removed to prevent contamination of clothing, skin, or mucous membranes and contribute to further spread of disease. Wearing gloves is not a substitute for hand hygiene. Staff must perform hand hygiene prior to putting on and after taking off gloves. All staff should review proper donning and doffing procedures and ensure personal protective equipment are disposed in proper waste containers after use. Mental health and substance use. Behavioral health teams should be involved in the planning and implementation of homeless shelter sites during the COVID-19 pandemic to help facilitate continued access to support for people with substance use or mental health issues. In some situations, an individual may not be able to comply with isolation recommendations due to a severely untreated mental health condition or substance use issue. Recommended practices are as follows. People with pre-existing mental health conditions should continue with their treatment plan and be aware of new or worsening symptoms. Consider specialist services that may need to be available, for example, mental health services, drug and addiction support or programming, and social workers. Those in isolation may need to refill prescriptions or may need access to daily medications such as methadone. Consider how to ensure they continue to receive their medication. If it is not possible to have mental health and substance use specialists either in person or by telephone, refer clients to services and programs in the community. There is a list of available supports in Appendix C of the document COVID-19 Pandemic Action Plan Guidance for Homeless Shelters. If at any time a resident is experiencing a psychosocial crisis, contact 519-973-4435, 911, or bring them to a local emergency department. If at any time a resident is experiencing an overdose, call 911 immediately and administer naloxone. If a resident has a treatment provider or mental health provider, advise them to contact this professional for guidance on continuing their treatment plan. Additional information can be found by reading the following documents: COVID-19 Pandemic Action Plan, Guidance for Homeless Shelters from the Windsor-Essex County Health Unit. COVID-19 Guidance, Homeless Shelters Document from the Ministry of Health. And by reviewing the Windsor-Essex County Health Unit website at wechu.org. For any questions related to managing COVID-19 at your facility, please contact the Windsor-Essex County Health Unit Infectious Disease Department at 519-258-2146, extension 1420, the Windsor-Essex County Health Unit Environmental Health Department at 519-258-2146, extension 4475, or the Windsor-Essex Community Health Center Street Health at 519-997-2824.